Florida families pay more and more each year for health care, and they're tired of it. Why do they pay more and more each year? Because the cost of health care services continues to rise. And really, it should come as no surprise that costs continue to rise. Imagine how much more we would all pay for gas if gas stations gave us no information about the price they charged per gallon before we purchased it. Instead, they just sent us a bill after the fact. Imagine how much we'd all pay for food if grocery stores gave us no information on the cost of meat or produce they were selling before we purchased it. Instead, they just sent us a bill after the fact. None of us would tolerate purchasing gas or food or other essentials in such a way, yet for some reason we put up with it when it comes to our health care. Well, those days are over. Representative Sprowls and I are proud to introduce bills that will shine a bright light on the cost of health care. This legislation will empower consumers with real, usable information about cost and quality before they make health care decisions. We're going to create a user-friendly, consumer-friendly website where Floridians can go and visit before their services are being provided and get an idea of what's a proper service and how much it's going to cost. And then consumers will take that information and be able to go to providers, and they will be required to provide a good faith estimate of how much these services are going to cost. This is usable, real information that consumers will have so they can make informed healthcare decisions.
You know, there's really not too many places in our country anymore where someone can come in and play by the rules and plan for their family's financial future and go into a situation where they go in for a medical procedure and come out bankrupt. They come out and their families can be devastated financially by implications and bills they didn't expect to get, many of which Senator Bradley referenced. Those need to change. We need to have some consistency and some predictability in our healthcare marketplace, because the fact of the matter is, in healthcare, there is no market.
The governor recently came out and said that you know, he's disappointed not to have for the bill to go further and have penalties for price gouging and stuff like that. Is that an option that you're still looking at? Is that, you know, why wasn't it included in the first draft of the bill, I guess?
Well, right now, I think that is one of the slight differences between the Senate and the House bill. The Senate bill does address unconscionable pricing and provide civil penalties. But I will tell you that, and the representative and I are of like mind on this idea that, you know, in the Senate, the idea of creating new crimes as a general rule, not just in the healthcare arena, but across the spectrum of public policy, is really not something that we're focused on doing. And so I think that it's fair to say that the representative and I are of the same mind that making these actions, alleged actions, criminal would not be something that's in our appetite or in the appetite of either of our bodies.
It seems like the bill addresses non-emergency care situations, and a lot of, I think, what consumers see unexpected bills in an emergency situation. So do you plan on amending the bill or including emergencies, balance billing issues in the bill?
Look, as far as the details of that, we certainly will be open to the conversation. We're looking forward to the testimony in both of our chambers and getting feedback from the stakeholders. I think it's obvious that in an emergency setting, there isn't time for that consumer to doctor or consumer to third party conversation that we anticipate in the bill. So we're certainly open to those ideas, but surely we don't expect for someone to be rolled into the emergency room and be able to have time to have that conversation.
As a follow-up, does that mean that the insurance consumer advocate wouldn't have the authority to investigate in an emergency situation or for either agency to find?
I think that the point about emergency services, and the representative is absolutely correct. If you're lying in a hospital and you're in a trauma situation, you're not going to be going through, okay, how much does this cost versus that cost, and that sort of thought process. You're wanting to stay alive, and that's what you should be focused on. But the aspects of the Senate bill that deals with unconscionable pricing and the consumer advocate, the ombudsman provision of the bill, certainly is intended to address emergency situations as well when a provider is not playing fair and is charging too much. It becomes law.
Can you comment as to a tax incentive that I guess is in the Senate bill but not the House? House bill for people who submit their claims data?
I think there was some discussion earlier about the insurance industry and its role in healthcare, and obviously that's a central role in healthcare. And I will say that those tax incentives in the Senate bill are meant to provide incentive for insurance companies to participate in providing data and being a part of what we're trying to accomplish. Because, as was mentioned earlier, a lot of folks, if they're dealing with something where insurance is covering all or most of a procedure, they're focused on how much that copay is. They're wanting to get a real picture of how much they're going to be out of pocket. And that's a fair question to ask, and we need to be able to give them the tools to not only know how much the entire procedure is going to cost, but how much they're going to have to pay out of pocket.
Do you feel like it would not be submitted if the tax incentive was not offered? Why offer a tax incentive to do it?
And we also have ERISA plans too that are reaching out, because that is a whole nother world in this complicated system. But there are other parts of the bill that incentivize participation, including when insurance companies are dealing with the state and having to acquire data in that situation. And we're not trying to tell people to do something. We're trying to incentivize them to be a part of the team.